Hi, thank you all for coming. Hello. So today I'm going to talk about repeated mild traumatic brain injury and whether or not there's a relationship with dementia. So I'm going to start with a few slides about the history of head injury and dementia and then go from there. So everyone's heard of the concept of being punch drunk, and that was a term that was first brought about in 1928. And it's kind of the same as dementia pugilistica. Somebody called Maitland described fighters who'd been boxers, and after some serious fights, they showed signs like unsteadiness of gait, mental confusion, slowness of muscular movements, as well as other symptoms like hesitancy of speech, tremors in their hand, and also tremors likely in their head. This wasn't described on a more sort of pathological basis or brain level basis until 1949, when somebody called Critchley described the brains of boxers. And the early descriptions of the brain changes that went along with something called chronic traumatic encephalopathy, or the more modern term for dementia pugilistica, I'm going to read this quote from one of the early descriptions. The outstanding findings consisted in a rich profusion of senile plaques scattered throughout the shrunken cortex, especially in the frontal lobes. Although the patient was only 51 years of age at the time of death, the histological picture was that of senile dementia, or alternatively of an Alzheimer's psychosis. So this kind of sets the scene a little bit for my talk. So this early description of a fighter who was punch drunk, when they looked at his brain when he died, although he was only 51, he was a young man, he showed Alzheimer's disease. So try to remember that as we move forward. And the slide there shows two components of Alzheimer's disease that we see in dead brains. One is neurofibrillary tangles, which are created by a protein called tau that I'll come back to later. And the other one is what we call senile plaques or amyloid plaques. So the other protein in Alzheimer's disease is amyloid. And I'm sure those of you who often come to Lunch and Learn know all about amyloid and tau. So an early clinical description of a boxer who was punch drunk came from this description by Critchley, same guy. And he had 23 similar descriptions, but I like this one. So a heavyweight, age 31, was knocked through the ropes in a boxing match in 1945 and was dazed for the next 24 hours. His right leg was found to be weak immediately after his fight and continued so. Within the next day or two, following the same fight, his right hand began to shake, so that's that kind of Parkinsonian shakiness. The left hand started to tremble some 6 months later, so it got worse with time. He was hospitalized 7 years later, a typical severe punch drunk. So this is really capturing the concept of this progressive disease. It gets worse with time. In this case, with this fighter, it seems likely that he had a brain bleed right after that nasty fight when he got punched through the rings, and then things got worse for him over time. So the early descriptions in the 20s, 30s, 40s, 50s were all about boxers. They're all about fighters. More recently, we hear a lot about football players, and that's kind of weird. Boxing still happens, we just hear a lot less about them. So we'll discuss some of those reasons in a little bit too. So these more recent pathological descriptions have come up with someone called Bennett Omalu. And anyone who saw the movie Concussion will know all about Bennett Omalu, who was played by Will Smith in this recent movie. And in 2005 and 2006, he reported single case studies of NFL players who had died. He was a pathologist. He looked at their brain after they died, and he described CTE in these sort of modern people. Anne McKee, who we'll discuss more, is a pathologist at Boston University. And in 2010, she described just 48 cases. These were all the cases that had been described around the world of CTE. And in 2014, Gardner, who I believe is Australian, described 158 cases worldwide. So it's becoming more of a phenomenon, but we still aren't basing this on thousands or hundreds of thousands of cases. It's just just over 100. So what is chronic traumatic encephalopathy? If you ask people who spend their life studying it, they're going to tell you it's a unique pathology, it's a unique disease. It's only diagnosable at autopsy, hence the gruesome brain picture, and it's reflective of a progressive neurodegenerative disease, which is what we consider to be a dementia. It's been described mostly in people who do contact sports, so football players, boxers, a clown who got beaten up a lot. The trauma that people sustain in these contact sports is thought to trigger this progressive degeneration of brain tumor and build-up of this protein called tau. And if you think back to that early finding, the 51-year-old boxer had both tau tangles and amyloid plaques in his brain. But CTE is really considered a tauopathy. The disease is caused by tau uniquely. It's only diagnosed by autopsy, and there have been some clinical criteria suggested, so these would be criteria for how we diagnose it during life, but they're yet to be validated. So we're yet to find out if they're useful criteria, and you'll see some of those criteria later. So this is CTE in the living person. So as recently as a couple of years ago, Montenegro, who works with the Boston University group, described traumatic encephalopathy syndrome. So this is CTE, which can only be diagnosed at autopsy as it manifests during life. So we have a similarity would be Alzheimer's dementia, which we see in life, and we can diagnose with some certainty during life, and Alzheimer's disease, which we can only really solidly diagnose at death. So the Boston University group have defined several possible changes in life which might be due to CTE, but they're very, very vague and they're very broad. So mood symptoms, depression and anxiety, behavioral changes, outbursts of anger, disinhibited behavior, domestic violence, cognitive changes, so memory changes, attention problems, executive problems, movement changes, so tremors, things that were described in those early boxers, and also headaches. So who in the last 5 years hasn't had one of these symptoms, right? So if you've had a bunch of these symptoms and you happen to be a college athlete or even a high school athlete, you might well meet criteria for traumatic encephalopathy syndrome. Are we really, really worried about your brain? Not really, based on that information alone. So that's where these data need to be validated. We need to learn more about what this disease looks like during life. This kind of isn't good enough at the moment, but it's a start. So recent research on CTE is mainly undergone at the Boston University group. So this is Anne McKee, slicing a brain, she's a pathologist, and Bob Stern, who is a colleague of mine, who's a neuropsychologist. They really lead the way, they have millions and millions of dollars in grant funding, and they're very passionate and they really want to learn about what's happening to these athletes. They have a large biobank, so they have a system where patients can say when they're alive that they'd like to donate their brain after they die, or where families of deceased patients can contribute their brain to science. As happens quite a lot, I'm sure we've all read about it in the newspapers. Dr. Stern has been conducting studies up until now with mostly retrospective data. So this is data that's collected after the fact. So a patient will come to autopsy and they'll have the brain and they'll find CT in the brain, and then they'll call or meet with the families and ask them some questionnaires about what was happening to the patient during life. Did they have headaches? Did they have anger outbursts? Were they depressed? What was their history of football playing or boxing or whatever sport they were in? So they're collecting as much information as they can, but obviously once someone's dead, it's a little bit difficult. Now they're collecting more and more data during life, so that really makes a big difference, and we're involved with that, as I'll tell you a little later on. So I wanted to talk about some definitions, because this whole world of brain injury and dementia becomes a little bit confusing, and different people use different words to mean different things. So the movie that came out recently was called Concussion. We hear a lot in the news about concussion in football and concussion in boxing, but what is concussion? everyone, I think, has a slightly different idea. And actually in our boxer study that we conduct here, that I work with Dr. Bernick, when we ask fighters if they've ever been concussed, despite histories of being knocked out and having some pretty serious brain trauma, some of them will say, no, I've never had a concussion. So there's no real clear definition, even amongst scientists. There's a lot of difference. And if you can pick and choose definitions such that if I banged my head against this wall now and had a slight saw stars for a second or had a slight headache, that could be a concussion. And if I was knocked out and in a coma for several months and only woke up later, that could also be described as a concussion. So it's so vague, it doesn't really mean much at all. I don't use it. These are a couple of the more formal descriptions. So there was this big consensus meeting in Zurich, the Zurich Consensus Statement on Concussion in Sport in 2012. And despite all these people flying off to Zurich and no doubt having a wonderful time and meeting and discussing things, the definition that they came up with was concussion is a complex pathophysiological process affecting the brain. It doesn't really mean a huge amount. It just means that there's a complicated process which has some pathological input, so there's some trauma to the brain, but it doesn't mean much beyond that. And then the American Academy of Neurology describes it as a clinical syndrome of biomechanically induced alteration of brain function, typically affecting memory and orientation, which may involve loss of consciousness. So again, it's very vague. You could be conscious, you could be not conscious. It might affect some aspect of your thinking. That could be memory, that could not be memory. It's biomechanically induced. Well, yeah, you're hitting your head. But otherwise, there's nothing specific. So I don't like the word concussion. It's too confusing. I'm not the only one. What I prefer to use instead, which is not perfect, but I think it's better, is mild traumatic brain injury. There are multiple definitions, but I think the World Health Organization's definition captures a lot of what we look at here with the boxing study, for example, or the football players when they get hit on the head in the field. So their description is an acute brain injury resulting from mechanical energy to the head, so the hit on the head, from external physical forces, thank you. And then they have one or more of the following. So confusion or disorientation, loss of consciousness for less than or equal to 30 minutes, post-traumatic amnesia, so they're not making new memories in the next day, they can't remember what happened, and or other transient neurological abnormalities such as a seizure or a focal sign, and they could even have a small intracranial lesion, so they can have a little finding on MRI. A Glasgow coma score, which is a measure that we use. If you have 13 to 15, it means that you're dinged but not completely out of it after 30 minutes post-injury. And this is not due to drugs, alcohol, or any of those kind of things. So it's a nice formal definition, and I wish that more of my colleagues would use that, because then we really anchor what we're talking about when we're talking about head injury. And most people who have mild traumatic brain injury will return to normal functioning well within 1 year of having the injury. We all bump our heads. It's just part of life. Humans have big heads, they get in the way, we're clumsy, we bump our heads. Not usually a big deal. So what is dementia? Well, I'm probably preaching to the choir a little bit. You guys could probably all tell me this just as well, but I think of it as a progressive neurodegenerative disease. So it gets worse, and it's caused by changes in the brain. And it robs people of their ability to be independent. So over time, people get more and more dependent on their loved ones or paid caregivers. There are several causes of dementia. So the most common being Alzheimer's disease, which is caused at the brain level by changes in amyloid and tau. Frontotemporal dementia, which is kind of an important one when we're thinking about CTE, which is sometimes caused just by tau. So like CTE, it's just a tauopathy. And the presentation of frontotemporal dementia is of changes in behavior, often impulse control issues. It can sometimes look a bit like depression. There's confusion. There are changes which might be similar to what we see in the football players who end up being diagnosed with CTE. Parkinson's dementia and related disorders, which are sometimes also caused by pure tauopathy. So the changes that we see in the brain in CTE are not unique to that disease. They might be uniquely distributed in where in the brain we find them But the protein itself is seen in a lot of these much, much more common, better understood conditions. And a lot of the behaviors and the symptoms are also seen in these other conditions. So all of these different symptoms can, just like traumatic encephalopathy, have cognitive changes, behavioral changes, mood and movement changes. So it becomes really difficult to disentangle what's happening. Another concept that I just wanted to go over briefly is something called cerebral reserve. So we know that people who sustain an injury or illness impacting the brain are more vulnerable to later getting dementia. So anyone who has meningitis as a child, or a febrile seizure, or any kind of early brain trauma, or even has a learning disability like dyslexia or something like that, is more vulnerable when they get older to getting something like Alzheimer's disease. And the idea, as illustrated in that little picture there, is your brain is kind of a tank, and you only have so much brain power to lose in your lifetime. It's very happy. So one concept that people have brought up with CTE is that these guys may have eventually become demented anyway, but they have an earlier impact or an earlier onset because of all the brain damage that they've sustained. Another more positive aspect of cerebral reserve is that people with more brain healthy lifestyles, people who have more education, who are more stimulated, who have better diets, who aren't obese, who sleep better, build up resistance against brain disease. So the idea here is that having multiple TBIs, multiple traumatic brain injuries, could eat away at that cerebral reserve, and you end up having a disease of old age, but earlier in your life. So back to CTE itself, and I won't test you on these definitions afterwards. So what is the evidence for CTE? So far, all of the autopsy-proven cases of CTE have had some history of head trauma. It hasn't always been sport-related, but in the majority of cases it has been. So as I mentioned, there was a clown, and he was involved in a lot of head trauma situations. Some have had epilepsy, and certain people say, well, when you have a seizure, you rattle your brain around, so it's likely the same mechanism. But in the biggest case series to date by Anne McKee, the pathologist in Boston, 44% of cases also had amyloid in the brain. So they didn't just have the tau, which is argued as what causes CTE, they also had amyloid. And when you find those two together, most of us think Alzheimer's disease. It tended to be the older people, so most of us as we get older will develop amyloid in our brains anyway. Again, hard to disentangle. And this is a picture of a normal brain versus somebody who was diagnosed with advanced CTE, and you can see it really ravages the brain. So let's go back to tau. Why is tau important, and what is it anyway? Tau is something that we all have in our brains. In fact, we need to have tau in our brains. It's generally kind of a building block of the brain cells, which helps the brain cells communicate with each other. But it becomes distorted with disease, and it becomes hyperphosphorylated, and that's when it starts causing problems. It builds up in several conditions, so various dementias, including Alzheimer's disease, as I mentioned, and frontotemporal dementia, but also non-dementing conditions. So people with opiate abuse who've died have been shown to have CTE in the brain, tau in the brain. And we've also looked at people who've died throughout their lives, and we find that tau is also a normal part of aging. So even children who've died and had their brains autopsies have revealed some tau in the brain. So it's not that unique, it's not that special, but the pattern that has been described in the literature by the CTE experts might be specific. So particularly, I don't know how well this pointer works, but not really at all. I'll just point. So it's said to build up in, this is a normal brain. Nice, normal, dead, but otherwise nice brain. And this is a slice, similar slice, and this is the area of the brain called the amygdala, where it's considered to be kind of an emotional center of the brain. There's a lot of tau. All that dark browny purpley stuff is tau. And also in the depths of the sulcal fold. So if you think about how your brain, yes?
I'm just wondering, are there symptoms that come with tau?
There aren't specific symptoms. So the question was, are there symptoms that come with tau? And there's no specific sort of one-to-one, if you have tau in the brain, you have this symptom. So in Alzheimer's disease, for example, they can show that where the tau plaques are most concentrated in the brain, say it's in the memory centers, you'll have worse memory. And if it's in the movement areas, you'll have worse movement. And no one's been able to show that in CTE yet. So it's not the molecule of tau itself that causes the problem, it's where it's built up in the brain. Does that answer your question?
Yes.
Perfect, okay. So in the sulcal depths here, and then here in the hippocampus in this person who's even more advanced. And you can see this is the slide showing all of the different little tangles, which are tau neurofilament tangles, which build up and they stop the brain from working. They stop it from communicating properly. So that pattern is meant to be unique. And we're not sure why it happens. Another thing that happens sort of uniquely in CTE is it's found in the perivascular area. So your brain is penetrated by lots of blood vessels, and around those blood vessels is where we find a lot of the tau build up in CTE. So one theory there is that when the brain is shook around, there's a little bit of leakage or some kind of reaction around those blood vessels, which leads to the buildup of tau. And that we don't see in Alzheimer's disease. It's something different. What don't we know about CTE? So remember, a couple of years ago, there were only 158 cases reported all over the world. There's a lot we don't know, a huge amount. We don't really know how specific that tau pattern I was just describing is to people who have multiple hits in the brain. And the only way we'll find out is if we have really good case-controlled studies. So people who have some of these same symptoms, headaches, depression, mood problems, memory problems, as we see in CTE, but don't have the head trauma, do some of those people have the same kind of pattern? To your question, does the amount or location of tau correlate with behavioral symptoms? Well, right now we don't really know. So because a lot of the data that we have on these football players who've died has been collected over the phone with family members. We don't know, for example, if memory problems relate to where tau has built up in the brain of the people. And there's studies that I'm going to talk about in a little bit which are going to help us to understand that. Do some people die with CTE-like changes in the brain, but they never had any symptoms? So we see this with Alzheimer's disease, and it often goes back to a different kind of reserve, cognitive reserve, where some people will die of some other cause, cancer or heart disease or something like that, in their 70s or 80s, and if for whatever reason they have a brain autopsy, they might have Alzheimer's disease in their brain, but they never showed any symptoms. And it would be interesting to know if that is also sometimes the case with CTE, because then we're less sure about the link between the symptoms and the disease. Quite a few of the people, and not that many, but quite a few, 15 to 20% of the people who've ended up having autopsies of their brain have committed suicide, and some horribly well publicized ones have purposely shot themselves in the stomach so that they could have their brains intact for autopsy. Do people who commit suicide who have not been professional contact sports players also have tau in the brain? Is it a biomarker for depression or suicide? Again, I don't think anyone's looked at this yet. We just don't know that. We don't know how specific it is. And what about steroids? So this is something that's not really spoken a huge amount about, but we know that a lot of athletes have, at some point in their career, experimented with steroids. It's very, very difficult to study because it's usually illegal. It would usually get them barred from their sport. It might prevent them from getting their pension or prevent them from getting payouts in lawsuits. So getting someone to admit to steroid use is difficult, so it's very difficult to study it. But maybe there's a link between steroid use and CTE. A lot of the symptoms of what we think of as roid rage, which is why we have the Incredible Hulk there, are similar to what we see in CTE: impulsiveness, anger, abuse of others. So we don't know that link. And is it really progressive? Do we actually see, or is it the result of one major injury to the brain? Or is it something that triggers a progressive dementing activity? And also, do older people just have tau in their brains? Well, we kind of already know that that's actually the case. So it's really difficult to study, and this talk is probably quite confusing because it's a really confusing subject. So one issue is causation and correlation. We know that some of these football players have the pathological changes, which we know to be called CTE. But was this caused by their career? Was it caused by the traumatic brain injury? We don't know. We know that when there's a lot of shark injuries, there's also a lot of ice cream eating. Does ice cream eating cause shark injuries? Probably not. They just both happen to happen in the summer. So there's an issue there that we really need to work out what the causation is. The lawsuits are also a complicating factor. So I'm sure everyone here has heard about the huge lawsuit against the NFL for almost $1 billion to pay out people who played for them who now have cognitive problems or have died with cognitive problems. And the fact is that a lot of these retired football players will end up with nice big payouts based on their cognitive injury. So it's difficult to come in and test them without that bias, and for them to be involved in studies which look at their cognition without knowing that if they act a certain way, they might get money. Not to suggest that they're dishonest in any way, but we've done several studies on people who are involved in lawsuits versus not involved in lawsuits, and it does affect the way people behave in testing situations, unfortunately. I'm going to get back onto my steroid soapbox. So we do need prospective studies including steroid use. And we found actually with the boxers here at the center who we study that steroids do change the brain. So some of our boxers, not many, 30 out of 600, admit to steroid use, and their brains are different from the other guys. We also need new studies of young or middle-aged men with depression or suicide who have not played contact sports. And even Bob Stern himself, so this is somebody who's received millions and millions of dollars of grant funding to study CTE, he's really the face of CTE, has said that there's been a lot of hype about CTE that has gone way beyond the science. There's also probably some overlap with the normal population. So there was a study in 2009 where this guy Weir called over 1,000 former NFL players to ask them various questions about their behavior. And that over 30% of former players over the age of 30 said they sometimes have outbreaks of uncontrolled anger, which sounds awful. It sounds terrible, that's a lot. And some of the descriptions that they had were throwing things, hitting someone, exploding. But it's not that unusual in that age group when you look at the population numbers. Anger discontrol is common in this age group in non-players too. And the numbers that I was seeing were actually higher, and I have a hard time believing that. Similar with suicide. We think a lot about former NFL players and suicide, but in the population studies we find that less NFL players commit suicide than other men in their age group. So what we read, there is a lot of hype in what we read. It sells papers. There's also some negative outcomes of some of this CTE hype. So, for example, a former National Hockey League enforcer, Todd Ewan, that's the picture of him, became absolutely convinced that he had CTE. He decided he had CTE, he decided nothing was going to make him better, and he shot himself. Came to autopsy, he shot himself in the abdomen, came to autopsy, and there was no CTE in his brain. So these guys are scared. We see the football players here as part of a trust program, and a lot of them are really, really scared about CTE, and it seems that we've got so far ahead of the science. A lot of families now are saying they won't let their kids play football, they won't let their kids do some of these sports. Well, we have a massive obesity epidemic in this country, and not allowing children to play sports isn't going to help that. Obesity is a massive risk factor for most of the diseases that we treat here. It's a detraction from research into other neurodegenerative diseases. So if we got some of the attention for Alzheimer's disease and frontotemporal dementia that we got for CTE, we'd have more money to study those that impact a lot more people. Remember, only 158 of these cases have been described. Similarly, former athletes who present with problems like depression or memory loss might not get the right treatment. They might not get medications or other interventions for reversible conditions such as depression or sleep apnea, because physicians might assume that they have CTE. And we've seen that here too with patients coming in from other centers who've been diagnosed with CTE during life, when it seems much more likely they have something reversible. So some of the questions that we can answer in the future, which will be useful, and I think that the scientific community is really driving towards these questions, is CTE actually a separate entity, or are we just looking at something like frontotemporal dementia or Alzheimer's disease that has happened to these guys a little bit younger than it would otherwise, potentially because of so many hits to the head? What really are the manifestations of CTE during life? Is it different from those other diseases? What is the role of steroid use? Would these people have developed dementia anyway, and did so earlier due to low cerebral reserve? That's a really difficult question to answer without a time machine, and cloning people. How can we best take care of these patients and their families? And there is got one. But that's the most important thing, of course. We want to make sure that people get the right information, that they get the right education, they get the right interventions if one exists. Something really exciting that's happening in some part on the back of this CTE literature is we're now able to look at tau in the brains of living people. And it's not a perfect science at all, it's very, very new, but there are PET tracers. So we have a PET scanner here at the center, and we can inject a medication into, a slightly radioactive medication into people that travels to the brain that binds to tau. And there's two different kinds of tracer that we can use. Some bind just to tau, some bind to tau and amyloid. And we don't know quite yet how well it correlates with the tau that we see in autopsy, and that'll be the million-dollar question. But it seems that we're making huge progress, because that's going to massively help our understanding of CTE during life, as well as all of those other tauopathies. So that's exciting. It's something that we're doing here with our boxers as well as with our Alzheimer's patients in clinical trials. The tau ligand is not FDA approved, so it can only be done in a research setting. And again, it's about the distribution. We don't know enough, but we're learning more. So what are we doing here to study the link between brain trauma and neurodegeneration? Well, we have the Professional Fighters Brain Health Study, which was started about 5 years ago by Dr. Charlie Bernick, and I joined the study a year later. And we've studied over 600 fighters now, most of them active, but some of them retired. And we're learning a lot about their brains and the relationship between differences we see in their brains compared to average people, and how that might relate to their experience as fighters. And we've identified regions which appear smaller with more exposure, and also in those fighters who have the slower thinking. So I think we're getting at something there. We are using different imaging modalities, including tau imaging, to study a subset of those fighters, which is really exciting. I don't have any data to show you yet, but we're right on the brink of being able to analyze that and show you the data. We also have, we're part of a $17 million grant in collaboration with those people at Boston University to look at football players. So right now we see football players in the clinic here as part of a program with the NFL Players Association, but soon we'll be able to start studying their brain, doing really good testing, obviously in live football players, doing some of that tau imaging and other MRIs and looking at their blood and really trying to understand what's going on with these guys. And so it's an exciting time to understand what might be happening. So as lay people, what can you do to help? Well, for the boxing study, we are looking for young people, mostly men, to be controls. So that's people who come in who aren't fighters, who we scan. So if anyone has any friends or relatives who might want to participate, send them our way. And also, I just always ask people to read Critchley. There's just so much hype. There have been some really good articles in the New York Times recently about the science, the media getting ahead of the science. But almost every day there's something about concussions in football. And in almost every one of those articles, I sort of brace myself, because there's always something, there's some kind of untruth or exaggeration. So just read critically and be demanding of evidence. That's the end of my talk. Thank you very much for listening.
Thank you.
Yes, please. Hi.
What does PTSD affect the brain in any way? I mean, have you made studies of that, PTSD? with all the
PTSD,
veterans coming
yes.
back?
So I think that's a really good point, and something that's very important when we're looking at CTE, of course, is our veterans' health. And that really coincides. So when we're trying to study CTE in veterans who are often exposed to blast injuries and other kind of head trauma, PTSD really overlaps clinically because we get the depression and impulsivity and withdrawal and a lot of the symptoms that look similar. So Dr. Bernick and I are actually writing a grant right now to look at boxers and veterans to see if there's any similarities or differences between the way blast injury affects the brain in those two populations. And PTSD is something that we're going to have to take into account because it's so prevalent in that group. So, yes, please.
Did you state that there was not a clear correlation between the MRI and autopsy? You don't know if these tau is the same.
Mm-hmm.
Is there some way to infuse a dead brain with the marker,
Right.
and then do an autopsy on the brain and see what?
I think that's one way they do it. The other two ways that they do it are with rats and mice. So they'll give them the disease somehow, and then they'll sacrifice them so they can scan them and then autopsy them within a few hours. And then the other way to do it, and this is a reality, although it's a little bit morbid, is to look at people in hospice settings who are likely to die soon, who have volunteered and their families have consented to having them have the scan, and then when they die some weeks or months later, they come to autopsy so we can get that information. And they're doing that now, mostly with other tauopathies, something like progressive supranuclear palsy, which is related to Parkinson's disease. So we will understand that, and it's just a really exciting time for that kind of PET analysis, because we all think that we're onto something, but we're not quite sure what yet. So.
I would another question.
Of course, please.
On the cerebral reserve,
Mm-hmm.
I guess if I take it that it's good to have that.
Oh, yeah.
But it's also good to have that if you're going into surgery,
Mm-hmm.
where you can have ICU psychosis.
Yes.
Is that right?
I think in general, people have shown that having cerebral reserve, having a healthier brain, staves off any kind of negative impact, whether it's something that you develop later on in life, like an illness or reaction to surgery or something like that. It's just generally good, so it's why we should all get out and get walking and keep our brains as healthy as we can, come to these kind of events, really build up that reserve and make sure that you do as much as you can to make your brain healthy. Yes, please.
I have two questions.
Okay.
First of all, it's CTE and then there's something called TES.
Yes.
What's the difference?
Oh, that's a good question. So CTE can only be diagnosed after you die. So it's a pathological diagnosis. So the pathologist diagnoses that. And then TES is a term, traumatic encephalopathy syndrome, I believe, that the same Boston University group have come up with to try to describe what happens to people during life. And that's where things fall apart a little bit for me, because I think it's just too vague.
Okay.
We need to come up with it. And part of the work that we're doing with them on the UO1 will be ensuring that up and making a tighter understanding, so that we're not diagnosing people who are depressed in their 60s who happen to be like high school cheerleaders with TES, because then everyone will have it.
Okay. And then can I
Yes,
ask
of course.
one
The
more
second
thing?
question.
My granddaughter was in sports, you
Mhm.
know, in her teens, and then she had a bike accident, got a concussion, and, you know, had a helmet, and, you know, which cracked, and they said, oh, she's so lucky, blah, blah, blah.
Yeah.
A couple years later, she was getting headaches and things, and they diagnosed her with post-concussion syndrome, which I had never heard of, but I looked it up online and it's actually a thing.
Oh, it for sure is a thing, and it goes along with what I was saying about concussion, where it's vague. And when you're saying that she developed these other symptoms years later, that doesn't seem like it's likely to be linked.
Okay.
No one can say definitively it's not linked, but also headaches, and maybe she was in college or doing stressful things, and there was perhaps another reason. So it's difficult, it's tenuous. Maybe it's related, but it just seems as a clinician, I want to look for a different explanation.
It sounded like a catch-all to me and kind of like
Trash can
smushing it over.
diagnosis.
Yeah. Thank you.
You're welcome. Any other questions? Well, thank you so much for coming and listening, and I hope to see you again soon.
Thank you.